book. So the physician is Diane Craig. Diane Craig is a hospitalist. And what she noticed is that although only 2% of people being admitted to the hospital came in with a diagnosis of sepsis, it was the leading cause of death, 1 in 6. And it's not Kaiser Permanente, it's every hospital in the United States. And she wanted to understand what was going on. And so she pulled data on a lot of patients. And what she found is that they all came in a little sick, but not very sick. And she asked herself then, well, could we predict what's going to happen to a patient who's only a little bit sick tomorrow and the next day? And I think this is one of the key learnings in healthcare, is that we tend to have a retrospective view or a current view. We need a future view. So she looked at the data, and what she saw is that patients presented with a set of conditions consistent with an infection, but not diagnostic yet of a septic shock. And she said she looked to see how often a blood lactate was ordered and the other associated tests that you know so well as a clinician. And she said that most of the time they were not being ordered. And she said, well, if we order these tests all the time, we have some data on the tests, then we at least can have better information. And so she built into a protocol an approach that said anyone who had 2 symptoms consistent with infection, even if they don't have it, we're going to obtain the appropriate lab work. And then with the appropriate lab work, step 2 is she saw that there was this group of intermediate lactate patients. And again, too complex to know all the details. So people were totally normal, people in septic shock, but this middle group. And she said, what would happen if some got treated and some didn't? So she looked again into the same database. Kaiser Permanente has a totally comprehensive electronic medical record, which is really the key to this process. And she saw that these people in the intermediate zone didn't always go on to septic shock, but a lot of them did. And if you treat them early, she was then able to demonstrate that people now would not get into septic shock, not need the ICU, but it required aggressive treatment earlier than physicians felt comfortable. Why was that? Because they didn't have 100% diagnosis. And this was a major advance, which is to say, how do doctors think? They say, I want to treat when I have my diagnosis. No. Even if it's a 30 or 40% chance, we're going to treat aggressively because the consequences of making an error on the left side, not treating, is far more than on the right side of treating, because treating was just fluid, which most patients could handle well. Not every patient, but most patients. And when she looked at that, what we were able to do is lower our sepsis mortality 40% below the rest of the nation. Today in Kaiser Permanente, our sepsis mortality is under 8%. The rest of the nation today is under 15%. And that gap is from the work that she did. And once it was demonstrated, once it was built into the protocols, once everyone was educated, so it's all those steps of change in the culture. We've been taught, first do no harm. And so that opportunity to let people understand that actually you're doing harm when you don't act, because you've now increased the probability of a major problem. That's a major psychological change. And once you make that change, now you can do it in so many other areas. She started in one emergency department in Santa Clara, Kaiser Permanente. Having demonstrated there that there now has to be rapid spread, so now it goes quickly to all of the emergency departments. It took about 1 year total. It then gets transmitted to New York City. To every emergency department is now following these exact same protocols, and we can expect that it's also going to be in other parts of the United States.